Hello, I'm Dr. Nathan Lawbaugh, and in my clinic, Back to Health, located in Tannersville, Pennsylvania, we are using new treatment protocols to help patients recover from their peripheral neuropathy. One of the main questions that I get asked from patients suffering with peripheral neuropathy is, will it work for me? They want to know, what are the chances I'm going to get better using these treatment protocols? Now, I can tell you in my office, using my protocols, approximately 85% of patients are going to get at least 50% reduction in their peripheral neuropathy symptoms. Now, that sounds like a random statistic to you, and you don't have a lot to compare that to. You're probably asking yourself, is that good? Is that bad? Let's give you something to compare that to. Let's talk about standard medical care. If you go to your medical doctor or your neurologist and they tell you that you have peripheral neuropathy, this is what they're going to do to treat you, and this is a study that looks at how effective their treatment is. This is called a pain control study, and it is the largest randomized clinical trial to follow 402 patients for approximately 3 years using what we call standard medical care. And here are some of the study designs here. Again, 402 patients. And what they did with these 402 patients, they gave them randomized. They gave them one of the 4 drug options that are most commonly given to patients: nortriptyline, duloxetine, pregabalin, and mexiletine. These may actually sound familiar to you. You may have seen some of this, one of these or more of these written on the bottles of medication that your doctor gave you for your peripheral neuropathy. So they gave these medications to 402 people, and they followed them around to see how they did. So here are some of the outcomes from the study, and a couple things that I'll point out here. First of all, in the study, they define efficacy, which is like, oh, success rate, right? They say that these medications are successful if they can give patients at least 50% improvement. So that's kind of the industry standard when we talk about dealing with very difficult chronic health conditions like peripheral neuropathy. A 50% improvement is considered a successful treatment. So when I tell you that 85% of our patients are getting at least 50% improvement, that's why we draw the line in the sand at that 50% improvement mark. The next thing I'll take a look at here is the quit rate. And in this study, we had about 402 patients that started. Fully approximately 40% of patients dropped out of the study before the end of the study. Now, presumably that's because the medications weren't working or the patient didn't like the side effects, but that's approximately 150 patients in this study out of the original 400 didn't even finish the study. Okay, that's how much they didn't like the medications. Of the remaining patients that completed the study, these are the success rates. Okay, 15 to 25% success rate. So we're talking about 400 patients that started this study. Only approximately 50 patients actually got at least a 50% reduction in their peripheral neuropathy symptoms. That's like a 15% success rate, 15, 20%. You know, we talked about in the beginning, our success rate in our clinic is approximately 85%. Of our patients are getting at least 50% improvement in their peripheral neuropathy symptoms. And that's doing treatments that don't have the side effects that are associated with these particular medications. Now, I think it's important for you to see this because if you've been to your medical doctor and you've been prescribed these medications and you feel like they're not really doing anything for you, you can't tell if they're helping or not, or maybe you're experiencing some of the side effects, which sometimes can be very severe, you're not alone, right? Fully 70, 80% of patients that take these medications do not get the desired effect. And many of them, as we go over here, we can see that greater than 70% of the people that took the medications reported side effects that included things like tiredness, forgetfulness, loss of excitement for life, and a loss of coordination and balance. So I want you to know that if you've been to your medical doctor and told him you have peripheral neuropathy, or maybe he told you you have peripheral neuropathy, and they've given you medications and you don't think they're working, or you're dealing with these terrible side effects, I want you to know 2 things. First of all, you're not alone, right? 70 to 80% of patients that take these medications are in the same boat as you are. The second thing is I want you to know that there are options. And those options include the types of treatments that we're doing in my office. As I said at the beginning, the success rate that we have found, which I believe is very good, especially in the context of the very poor treatment available at the medical doctors for peripheral neuropathy, is approximately 85% of our patients, and I'll stand by this number, 85% of our patients get at least 50% or more improvement of their symptoms. Have we had patients that say that they get 60%, 70%, 80%, 90%? I've had patients tell me they've used the term cure, that's their word, not mine, of their peripheral neuropathy. Absolutely, we do get that. So I want you to know there are options available, and they're actually very good. The final thing to cover real quickly, patients will ask me, well, do the results last? How long do the results last? What I can tell you is that I have found in the years of providing these treatments that the results are long lasting. And, I've even put kind of permanent question mark. Nothing in this world is permanent, but they are very, very long lasting. We have seen patients follow up with us at 12 and 24 months post-treatment, and they've retained essentially all of their gains that they got during the treatment protocol. Now, obviously, patients that take an active role in improving their lifestyle are going to help to amplify the results, cleaning up their diet, involving a little bit more exercise, things like that. They always help on the long run. So again, my name is Dr. Nathan Lawbaum. My practice is called Back to Health. We are located in Tannersville, Pennsylvania, and we are neuropathy specialists. So I would love the opportunity to sit and talk with you about your peripheral neuropathy, evaluate your condition, and see if our treatment protocols may be a good fit for you.